Svein, recently we've been working with a number of telehealth and virtual healthcare providers, chatting with them about their video setup. And cost has become a really big issue concern this year, given all that is going on in the macroeconomic climate. Of course, finding a new WebRTC provider that could give you a price discount can be one way to lower costs. But we realized that a far more impactful way to lower your costs with video is actually by finding a provider that helps you to reduce no-show or failure rates. By making even a 1% tweak in that can lead to significant increase in revenue or decrease in the loss of revenue. Can you speak more to what you've been learning through some of these recent conversations?
I can. So we have done an investigation into what's the typical call failure rate for telehealth calls. Keep in mind that in telehealth, it's patients that visits a provider. So the provider will typically be a repeat user that uses it again and again, but the patients will be most of the time one-time users. So the most important in telehealth calls is to make sure that it works for the patient, because if the patient is unable to get the call working, you have a no-show. And for telehealth companies, the no-show rate translates directly to lost revenue. Basically, you're not getting the revenue for that call that you should have. So we found that there's a number of things that can happen in video calls that will result in no-shows. The most important reason is that the patient is unable to select the correct camera and microphone and sound output to get the video call working. That constitutes about 5% of calls. So if you don't have any measures that counters that, you will get a 5% no-show rate just with that particular reason for call failure. There are other reasons as well. The call not being able to connect, the patient having not good enough network to get a working call, and maybe also cases where the patient has not a good enough device, and a device that can't really support good quality video calls. Together, all of these results in a failure rate between 15 and 20%. And those are numbers that we have measured. So it's observed from actual telehealth services. So it means that the potential for lost revenue is actually quite significant. If you look at a telehealth service that has maybe 100,000 consultations per month, quite significant volume, and you look at the potential failure rate, there is on the order of magnitudes of tens of millions of dollars per year that can be saved by reducing that no-show rate. And that is 50 to 100 times more than the typical cost for a video API solution. So this is definitely the area to focus on for telehealth services.